Welcome to our 5th annual Lyme Disease in the Era of Precision Medicine Conference. My name is Savi Glowe, and I am the event chair for this year's virtual conference. I have been with the LymeMIND program since the very beginning. Back in 2015, when those of us at Mount Sinai were just starting to dip our toes into the fascinating world of Lyme and tick-borne diseases. At the time, we were just a small team of data scientists who believed that the heart of understanding medicine and biology lay in collecting large amounts of novel data, applying newly adapted computer science methods, and turning around new insights and knowledge that could never have been done before. While we still believe and are actively working every day with this research foundation, we at LymeMIND have also grown in our understanding of the complexities and frustrations and difficulties faced by the Lyme community of patients, caregivers, physicians, and lifelong researchers. 5 years ago, we were the new kids on the block, joining a community with new ideas on how we might be helpful. But during this time, you have helped us to grow as scientists and community-centered researchers. In honor of our 5-year anniversary, I'd like to take a brief moment to share with you some special memories of the LymeMIND conferences over the years. Our first event in 2016 took place at our academic home in the Upper East Side on the main Mount Sinai Hospital campus. Our intention for our first year's conference was to bring together our new colleagues and consortium members of the Cohen Tickborne Disease Initiative. As new members of the community, we wanted to hear from the researchers who had been working on this disease for years and get a crash course in the field. At the generous request of the Cohen Foundation, we opened the event to everyone. We naively thought that we were going to get a few curious med students to sign up. We were providing lunch and breakfast and a reception after all. But instead, we had a full house register, and it wasn't just scientists and doctors filling the room. With very little publicity and outreach, our event center was filled to the brim with families, patients, caregivers, and advocates. Needless to say, our eyes were opened. As lifelong data scientists and academics, we never expected this level of informed community discussion and participation. It was the start of what would be an incredible adventure. We knew for 2017 that we had the same duty to make our event public. We followed almost the same program structure, but our time was limited. It was our second year as a consortia, and we had to do work as a community to get to the next level of our research collective. So our plan for 2017 was to host a half-day public event with an internal afternoon research workshop. We shouldn't have been surprised at this point to find ourselves joined by so many incredibly educated and motivated members of the Lyme community. Even with just a morning event, the turnout and engagement was inspiring. We knew we needed to keep the momentum going. The 2018 event had to go back to a full-day program. There were so many topics that we simply couldn't cover in 4 hours. But we also wanted to find a way to make the event more accessible and welcoming to the broader community. We reviewed some of the feedback from 2017, and it was clear that though the deep dive in science was interesting to patients, the research process is long, and it's far removed from the daily experience that patients have living with Lyme disease. So we decided 2 things. First, instead of making it a single-day event, we made it a 2-day event. The first day was dedicated to a deep dive in science and medicine, and at this event, we still got to nerd out and dig in deep. We hosted this event again at the New York Academy of Medicine. Our second day was spent at the New York Academy of Sciences. This event was to focus on building a community bridge between those of us in the sciences and medicine and those living with the disease. We wanted to make an event that would be informative and community inclusive. We hosted a small trade show and had a couple of breakout sessions designed to answer patient-specific questions on nutrition and health. But in 2018, we also launched the LymeMIND Stories program. The idea came to us in a lab meeting while discussing some recent genetic sample collection. One of the young researchers said to the table, "I've never met somebody with Lyme disease, and I didn't know this was even a problem a few months ago." The room echoed the same sentiment. We realized then that the gap in understanding was a tremendous deficit to our work as researchers and scientists. So we launched our story booth, beginning our journey to better understand the lives of those affected with Lyme and tick-borne diseases. And in 2019, we marked a truly monumental year. Last year's event took place at the beautiful New York Times Center in Midtown Manhattan with more than 250 people in attendance and a worldwide Facebook Live viewership of over 15,000. The event brought together all of the previous year's elements with a few special additions. We shared in a deep review of cutting-edge science. We enhanced our discussions around activism and community engagement, and we showcased the power of the arts to promote healing and understanding. Over the years with the Lyme community, I have been touched and honored. I have met some of the most selfless and dedicated professionals and have formed friendships that I know will last a lifetime. I have learned from every story, from every publication, and from every member of this community. I hold, as I have held the past 3 years in my opening address, a heart filled with gratitude for this opportunity to continue our work and share in this collective journey. I am grateful for my team, especially for Kathleen Stetcher, who has worked tirelessly to make all necessary plans and adjustments during an unpredictable time, and to pull off what I know will be another outstanding event. And on behalf of the entire LymeMIND team, we are thankful to Steve and Alex Cohen for their tremendous dedication and constant support. The Cohen Foundation's impact on the Lyme and tick-borne disease community in 5 years is unprecedented and remarkable. So here we are in 2020 at year 5 of our program. True to our ever-evolving history, we are yet again conducting a never-before-seen event. This year's virtual program, although short, will be jam-packed with informative discussions from leading experts across the field. Most of today's presentations have been pre-recorded to reduce any possible technical issues that may arise from the limitations of Zoom. However, a handful of segments will be conducting a live Q&A. The live Q&A will be announced by me at the start of each program, and questions can be submitted to our panelists via the chat text feature. And even though a formal Q&A is not available for the entire event, the text chat feature will be available at all times for all programs. Moderators and presenters are standing by to answer via text any questions that you might have. In between our segments, you will also see highlights from our talented artists in the Lyme patient community who have generously agreed to share their work with us. We at LymeMIND truly believe in the power of art for healing and understanding. Thank you for being with us today.